You press the cold end of your stethoscope against the man's chest and you listen. His heartbeat is steady, strong even. You write something on your clipboard, hand him a prescription, and tell him to lay off the salt. He nods, thanks you, and leaves. You watch him go. You've been a doctor for 11 years. Licensed, certified, respected. Your name is on the door. Your diploma is on the wall. People trust you with the worst moments of their lives, and you take that seriously. You always have. Then one night, everything changes. It's a Tuesday, late. Your last patient left an hour ago. You're alone in the office, finishing paperwork. When your
Your
phone
results
rings,
are back.
it's a
Is
number
it
you don't
serious,
recognize.
doctor? We need to
voice on the
discuss
other end
this.
is calm.
I understand.
Too calm. He tells you he has a friend. His friend needs help. His friend can't go to a hospital. He says he heard you're a good doctor. He says he'll make it worth your while. You hang up. He calls back 3 minutes later. Let's stop there for a second. Because what happens next isn't just a story. It's a pattern, a real one. Underground surgery networks have been documented in cities across the country, from Miami to Los Angeles to small towns in between. Some are run by people with no medical training at all. Some involve real licensed doctors, people who started exactly where you are right now, standing in a quiet office, holding a phone, making a decision they can never undo. The question is, how does a real doctor end up there? Usually the answer isn't greed. It's something quieter, a practice losing money, a malpractice settlement that wiped out savings, a license under review, or sometimes something even simpler. Someone asks, someone is desperate, and the doctor who spent a decade being trained to help people, helps. You answer the second call. The man arrives 20 minutes later. He comes through the back. He doesn't shake your hand. He's holding his arm at an angle that tells you the shoulder is dislocated before he even sits down. He says he can't explain how it happened. You don't ask. You reduce the joint, wrap it, hand him anti-inflammatories. He pays you in cash. More cash than you'd see from 3 regular patients combined. He leaves the same way he came. You tell yourself it's a one-time thing. You almost believe it. The second patient arrives the following week. A woman. Burns on both hands. She says she grabbed something hot and left it at that. The burns are second degree, maybe brushing third on the left palm. You clean them carefully, apply silver sulfadiazine, bandage them properly. You give her antibiotics. She thanks you quietly. She pays. She leaves. You sleep fine that night. That surprises you. By the 3rd month, you've seen 14 patients. Construction workers with broken fingers. They can't afford to have set. An older man with a deep laceration across his forearm, 22 stitches worth of work. A young mother with an infected wound that had been left untreated for a week because she didn't have insurance and was afraid of the bill. You cleaned it, drained it, prescribed the right antibiotic, and watched her shoulders drop 2 inches with relief. You start to tell yourself a story, and this is the part that matters, because the story you tell yourself is not entirely wrong. 2 out of 3 Americans report skipping needed medical care each year because of cost. Common dreams. Not because they don't want help, because the system prices them out. They don't fill the prescription. They don't go to the follow-up. They wait until something small becomes something serious. Researchers estimate tens of thousands of Americans die every single year because they couldn't afford care. Common dreams. You know this. You've seen it firsthand. Patients who waited 6 months to come in because they couldn't afford the copay. By then, the infection had spread. By then, the lump had grown. By then, it was too late to do the thing that would have taken 15 minutes and $200 if they'd come in sooner. So when the woman with the infected wound thanks you with tears in her eyes, you don't feel like a criminal. You feel like a doctor. You feel for the first time in years like you're doing exactly what you were trained to do. That feeling is dangerous, and you have no idea yet. The referrals multiply. You never advertise. You never ask for them. But word moves through certain networks the way water moves through cracks, quietly, steadily, following the path of least resistance. Someone tells someone tells someone else. They all pay cash. They all come through the back. They all know not to ask your name out loud, and you know not to ask theirs. You start keeping notes in a locked drawer, not patient files, just dosages, procedures, things you need to remember. You tell yourself it's for safety. It is, but it's also evidence. You think about that sometimes, late at night, and then you stop thinking about it and go to